The Guilford County Department of Health and Human Services Division of Social Services is working to strengthen its child welfare practice. 90 days into a Corrective Action Plan, or CAP, received from the state of North Carolina in July of 2023, the county is making significant progress in three key areas: safety assessment and planning, permanency, and placement stability.
Guilford County has worked diligently to address the concerns of the state and implement the changes that are prescribed in our Corrective Action Plan. Our efforts should demonstrate that Guilford County has not approached the CAP as a checklist, things to simply be marked off our list, but as an opportunity to improve all areas of practice and service delivery.
With more than 500,000 residents, Guilford County is the third largest county in the state of North Carolina and is unique in having two cities where residents can receive services, Greensboro and High Point. This makes it more convenient for residents, which is a good thing. But the two courthouses, offices, and workforces also make it challenging for staff.
We are working really hard to make sure that all 300 employees are moving in the same direction. That's one of the things that our training and onboarding team has spent a lot of time on is consistency in making sure that we are interpreting policy correctly and making sure that they are able to receive the training that they need.
What really stands out for me over the past 90 days is the level of intentionality that the Department of Social Services has moved in developing our social workers. Our social workers have put in an absorbent amount of time as it relates to training.
100% of staff have taken back to basics, practice standards, and first-year trainings offered through the state. Historically, these trainings have had limited space due to high demand, so the state has given Guilford County DSS staff priority.
We really have gone back and started to change our outlook on how we do things and be able to implement new tools in each areas of child welfare that will help not necessarily simplify it, but streamline it in a way that all levels of child welfare, from social workers to supervisors to program managers, all the way up the chain, can be a part of this.
On top of our state trainings, we have also had the QA team come in and do trainings like on safety assessments, do training on kinship assessments, structured decision-making tools. And in addition to that, we have retired callbacks that come back. So they are retired program managers that are coming back and assisting us with tools and things that we need as far as our caseloads.
New policies, best practice guidelines, and tools are helping address several areas of the CAP, including ensuring supervisor oversight in assessment decisions, making sure at least one program manager weighs in on staffing decisions, and ensuring regular contact with families is maintained, immediately documented, and workers are applying what they've learned in training when out in the field.
We have been under a corrective action plan for the last 90 days, but well before we received information from the state, we had our own concerns and had already begun to dig deeper into areas where we felt like there were practice challenges. We had already begun to ask our county leaders and county commissioners for additional resources. So while it has been 90 days that we've been on the corrective action plan, we've actually been working for months and months on making sure to shore up our practices, making sure that we had the right staff in the right positions and the right training and resources available.
One of the things that we're working on improving is to do more targeted audits, and then the results of those audits will create a training the following month so that we can follow up on anything that we're seeing any problems with, to make sure we're following that CQI process of the continuous quality improvement so that we're catching things before they become a problem or grow into a bigger problem.
The CAP also identified challenges related to the number of children in foster care, the length of time they are in care, the amount of placement changes they make during their time in care, and the number of children who are placed with relatives, also known as kinship placements. To address these findings, DSS has adjusted its processes.
We recognize that it requires a hands-on approach through coaching and development to make sure that we can hit the mark each and every time in quality service delivery with our safety assessments, and then also understanding how do we come together in intentionality around placement moves.
DSS now schedules the initial child and family meetings based on the scheduling needs of parents and families. DSS worked with the state to develop new guidelines for social workers as they develop out-of-home family safety assessments, and implemented targeted internal reviews of cases where children have been in foster care for more than a year.
We want to make sure that every child, when they enter into the foster care system, can move towards some level of permanence within 1 year, and really move in a plan to where children can either be reunified or either engage in some form of permanency, such as guardianship, adoption, or either custody.
It always comes down to the safety and the permanence of the children that we are working with. It's really important that everyone is on the same page when it comes to the ultimate goal of permanence for the child, whether it's reunification or another permanent goal, to not elongate that child's time in custody, because it impacts everyone involved, and especially the children involved.
To improve permanency, DSS is also working with partners on placement stability outcomes, striving to move children in foster care as little as possible. The county's new escalation protocol helps identify possible placement disruptions ahead of time to keep kids who can't remain safely at home within their community and culture. Improved processes and court collaborations have helped Guilford County double the number of kinship placements since July, and the county expects to be at more than 6 times the original kinship placement rate within the next 90 days.
As the assistant county manager, what's important to me when we look at our court partnership plan and moving forward in this endeavor is to make sure that children and families are honored in the process. And what's imperative is that we lean into this with a strength-based approach. And we look at each and every child as well as their family system, and we explore their strengths. And we also explore what resources are needed to try to mitigate any risk factors or safety considerations.
We have 3 main purposes. The first one is the safety and protection of each and every child that comes within the jurisdiction of the court. But the second one, and just behind that, is returning children to their families as soon as we can, so long as we can do it and still make sure that those children are kept safe. And then finally, number 3, making sure that everybody who's involved in their process has their rights protected and upheld, that they're treated fairly and their legal and constitutional rights are protected.
Relationships and communications are critical in child welfare work, and the county has hired a third-party consultant to survey foster parents and identify areas of concern so they may address those needs with resources, training, and additional support.
It is extremely critical that we put families first when we look at our court partnership plan. Parents hold a pivotal and crucial role in that plan because we want them to be successful. And we recognize that this process known as foster care can be complex. We also recognize that it can be intimidating. And when we say as social workers that we hold them as our client, we want to make sure that we can help remove all of those concerns and work with them to move towards success.
Everybody who's involved in the system is in it out of a real concern and a real heart for it. You literally can't do this work unless you really, really have a commitment and an ability to empathize with the folks who are involved and a real care for the families.
From staff training to safety, permanency, and placement improvements, through the CAP process, Guilford County is engaging staff, partners, and families of all kinds around the health and well-being of children involved in the child welfare system. That work will build as the county moves forward into the next stage of the CAP process.
I think in the next 90 days, you can expect to see really more consistency and more stabilizing of the workforce, working really diligently with our court partners to shore up some practices there. And just it's been a real spirit of community cooperation, and I think you can expect to continue to see more of that in the next 90 days.